Member Cardston-Taber-Warner, followed by Edmonton Goldbar.
Thank you, Mr. Speaker. As AHS knows, the Cardston Hospital has exceeded its best-buy date. The main structure is over 60 years old, and it's been 33 years since the last renovations were done. As the Minister may appreciate, since the doctors and people of Cardston were told in 1999 that they were next in line to receive a new facility, the government's promises lack just a little bit of credibility. What will the Minister do to reassure them that this critical new hospital will actually be built?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and thank you to the Honourable Member for the question. The Cardston Hospital is one of a number of hospitals in Alberta, Mr. Speaker, that were built in that particular area that require renovation and in some cases replacement. I think the Honourable Member knows that this particular project is on the 5-year list that Alberta Health Services has established. I recognize the importance of the facility to the community, and Mr. Speaker, that is where the project stands at present.
For supplemental.
Thank you, Mr. Speaker. Of course, in 1999, it was next in line, so being on the 5-year list may not be as reassuring as we'd like it to be. Given that Cardston is fortunate to have dedicated and skilled doctors, nurses, and support personnel to serve the thousands of people in the town and area, as well as the about 10,000 people on the largest First Nations reserve in Canada, will the Minister tell us when Cardston will be getting this long-promised hospital?
Honourable Minister of Health.
Well, Mr. Speaker, as I'm sure the Honourable Member appreciates, we are not living in the 1970s in an era where in most of Canada, and certainly in Alberta, we sought to have full-service hospitals with all programs and services in every community across the province. Mr. Speaker, Alberta Health Services is undertaking very detailed planning at the zone level now about what the roles of hospitals will be, and they will all play specialized roles in the future. As the Honourable Member knows, AHS has recognized the need for physical renovation of the facility and will continue to work toward putting the right project in place.
Final supplemental.
Thank you, Mr. Speaker. We're counting on that, of course, Mr. Minister. And while it seems to make sense that doctors and healthcare professionals in Cardston would be consulted and that their recommendations would actually be listened to, this hasn't been done so far. What will the Minister do to make sure that this actually happens?
Honourable Minister of Health.
Well, Mr. Speaker, I'm really actually grateful to the Honourable Member for raising this point. As I've said in this House before, I believe that there is a greater role that health advisory councils can play in this province in terms of long-term community planning for health infrastructure, providing feedback on services that are provided at the local level. And what I'm committed to do, Mr. Speaker, is working with Alberta Health Services and those council members to expand their role, to provide them a greater voice in the kind of planning that the Honourable Member is talking about. I think that's very worthwhile.
Thank you.